Good morning, everyone. Bon matin. Dans quelques instants, Dr. Tam et Dr. Njoo vont parler des projections les plus récentes concernant une hausse de la pression sur les hôpitaux et les travailleurs de la santé à travers le pays. More people are getting sick with COVID. And of course, the more people who get this disease, the harder it is to control. It also begins to spread more easily to remote and rural communities like Nunavut and Northwestern Ontario, where hospitals are smaller and systems are more fragile. I've been working closely with health leaders in all provinces and territories to ensure that they have what they need to deliver on their healthcare responsibilities. I recently spoke with Minister Kusagak of Nunavut to ensure that we can continue to help with their outbreak. There has been some encouraging news on vaccines lately, and that's giving us some hope of relief, but we need to keep pulling together using a Team Canada approach. Everyone has a role, a position to play. Businesses can continue to protect their staff and their customers. We can all support our hardworking healthcare workers and our families. This wave is undeniably harder. We are all tired, we are all lonely, and we all want our lives back, but we can't give up now. We see the light, the potential of vaccines and spring, but we also have to get there first. So let's all pitch in to get everyone there safely. Each decision that we make matters. Think about the choices that you're making carefully, because lives actually depend on it. Is my travel essential? Do I need to go out today? Can I reduce my shopping time? Do I need to have that dinner? This will be especially hard as holiday season approaches. But I know that we can be creative in the way that we stay connected more safely. Avec la saison des fêtes qui approche, ce ne serait pas facile. Mais la réalité est qu'il faut réduire ces contacts maintenant pour protéger nos proches now to protect our loved ones. Thank you very much.
Good morning, everyone. Bonjour à toutes et à tous. Today, we'll provide an update on the national epidemiology and modeling work that informs the ongoing management of COVID-19 in Canada. To date, there are about 52,000 active cases in Canada, and despite having over 315,000 cumulative cases, less than 1% of the population across the country has tested positive for COVID-19 to date. This is an important reminder that the vast majority of Canadians remain susceptible to infection. We'll continue rapid growth in daily case counts, rising numbers of hospitalizations and deaths, and spread in high-risk populations and settings. There is urgency to quickly bring infection rates down across the country.
Bonjour à toutes et à tous. Aujourd'hui, nous ferons le point sur les travaux d'épidémiologique et de modélisation effectués au pays qui orientent la gestion actuelle de la COVID-19 au Canada. À ce jour, il y a environ 52 000 cas actifs au Canada. Malgré le fait que nous ayons atteint plus de 315 000 cas cumulatifs cette semaine, moins de 1% de la population à travers le pays a reçu un résultat positif à ce jour. Ceci est un rappel important du fait que la grande majorité des Canadiens et des Canadiennes demeurent à risque de développer l'infection. Avec l'augmentation rapide et continue du nombre de cas quotidiens, la hausse du nombre d'hospitalisations et de décès et la propagation à des populations à des milieux à haut risque, il y a urgence à faire baisser rapidement les taux d'infection à travers le pays.
Slide 2. The national epidemic curve shows that case counts have far surpassed peak levels seen during the first wave. An average of about 4,800 cases are now being reported daily. Moreover, epidemic growth is continuing at a rapid pace, and about 15% more daily cases are reported this week compared to the last.
Diapositive 2. Leur courbe épidémique nationale indique clairement que le nombre de cas a excédé de manière marquée les pics observés pendant la première vague. En moyenne, environ 4 800 cas sont maintenus rapportés chaque jour. De plus, la croissance d'épidémique s'accélère avec environ 15 de cas supplémentaires rapportés cette semaine comparativement à la semaine dernière.
Slide 3. Rapid growth nationally is being driven primarily by the 6 provinces outside of the Atlantic bubble. Although regional differences remain, all of these jurisdictions are currently experiencing steep increases in infection rates. Over the past week, each of these provinces has marked the highest daily case counts to date.
Diapositive 3. La croissance rapide à l'échelle nationale est principalement liée aux 6 provinces en dehors de la bulle atlantique. Bien que des différences régionales demeurent, toutes ces provinces connaissent de fortes augmentations de taux d'infection. Au cours de la dernière semaine, chacune de ces provinces a rapporté son nombre de cas quotidiens le plus élevé à ce jour.
Slide 4. The map of COVID-19 spread in Canada shows health regions with the highest 14-day incidence rates of COVID-19 in the deeper shades of blue. There are now 48 health regions with infection rates over 50 cases per 100,000 people, 9 more than we reported 3 weeks ago, indicating that the virus is spreading across a wider geographic area within Canada. Nunavut is now in the deepest shade of blue. The territory first locally acquired cases reported on November the 6th has now quickly grown to 70 cases within a 2-week period. Community spread in some areas has necessitated a 2-week territory-wide restriction period. Nova Scotia is another area of concern. While infection rates are low, several recent cases cannot be linked to other known cases, a sign that the virus is spreading undetected in the community.
Diapositive 4. Cette carte montre en bleu foncé les régions sanitaires qui ont présenté les taux d'incidence cumulatifs de COVID-19 les plus élevés au cours des 2 dernières semaines. Il y a maintenant 48 régions sanitaires qui signalent plus de 50 cas pour 100 000 personnes, soit 9 de plus que le nombre que nous rapportions il y a 3 semaines. Ceci indique que le virus se propage dans une plus grande zone géographique au Canada. Le Nunavut apparaît maintenant en bleu foncé. Le premier cas acquis localement, déclaré le 6 novembre, a rapidement mené à 70 cas en 2 semaines. La propagation communautaire dans certaines régions a nécessité une période de restriction de 2 semaines à l'échelle du territoire. La Nouvelle-Écosse nous préoccupe également. Bien que les taux d'infection soient bas, plusieurs des cas récents n'ont pu être liés à d'autres cas connus, insigne que le virus se propage de manière non détectée dans la communauté.
Slide 5. The time-varying effective reproduction number, or RT, represents how many people are being infected by each new case. When each new case infects less than 1 person, the epidemic will die out. Nationally, the RT has been greater than 1 since the end of August, meaning that every 100 cases in Canada passes the virus to more than 100 others, and so on, with each new generation of spread getting larger.
Diapositive 5. Le taux de reproduction effectif variable dans le temps, ou RT, indique le nombre de personnes infectées par chaque nouveau cas. Si chaque nouveau cas infecte moins d'une autre personne, l'épidémie s'éteindra. Le RT du Canada est supérieur à 1 depuis la fin d'août, ce qui veut dire que chaque groupe de 100 cas au Canada transmet le virus à plus de 100 autres personnes, et ainsi de suite. Chaque fois que le cycle se répète, la nouvelle génération de personnes infectées est plus nombreuse que la précédente.
Slide 6. The percentage of people who test positive is another important indicator to monitor how hard we are looking to find cases and to gauge how much the virus is spreading. Based on the World Health Organization international benchmark, countries should aim to keep the percentage positive to under 5%, as anything above this could indicate we're not testing enough. The average percentage of people testing positive in Canada has been increasing for many weeks and is currently over 6.5%. This is a clear sign that transmission has increased. Spikes of up to 10% or higher test positivity in several provinces signal a need to increase testing to detect and isolate a growing number of cases in the community.
Diapositive 6. Le pourcentage de personnes qui ont eu un résultat positif au test est un autre important indicateur permettant de monitorer à quel point nous cherchons à trouver les cas et pour évaluer à quel point le virus se propage. Selon le document de référence international de l'OMS, les pays devraient viser à garder le pourcentage de positivité sous les 5%, tout pourcentage supérieur étant susceptible d'indiquer que nous ne testons pas assez. Le pourcentage moyen de personnes ayant un résultat positif augmente au Canada depuis plusieurs semaines et est maintenant supérieur à 6,5%. Ceci est un signal clair que la transmission a augmenté. Les pics de 10% ou plus de positivité dans plusieurs provinces indiquent un besoin d'accroître le nombre de tests effectués et d'isoler le nombre croissant de cas dans la communauté.
Slide 7. Across Canada, the incidence of COVID-19 has been consistently high among young adults aged 20 to 39 years since July. However, incidence has been steadily increasing among individuals 80 years of age and older for several weeks. Elderly adults in this age group are at highest risk of severe illness, outcomes, and death, and now have the highest reported incidence rates nationally as well as regionally in Alberta, Quebec and Ontario.
Diapositive 7. À travers le Canada, l'incidence de la COVID-19 a été systématiquement élevée chez les jeunes adultes âgés de 20 à 39 ans depuis le mois de juillet. Cependant, l'incidence est une augmentation constante chez les personnes de 80 ans et plus pendant plusieurs semaines. Les aînés de ce groupe d'âge présentent le plus grand risque de maladies graves et de décès et ont maintenant les taux d'incidence les plus élevés à l'échelle nationale ainsi qu'au niveau régional en Alberta, au Québec et en Ontario.
Slide 8. COVID-19 spread into high-risk populations and settings is very concerning, particularly as more and larger outbreaks are being reported in long-term care homes, healthcare settings, and Indigenous communities. Outbreaks in long-term care homes put elderly residents at risk of life-threatening illness. Outbreaks in healthcare settings put an increasing strain on health system capacity and directly affect the health and wellness of patients and our healthcare workforce that is increasingly exhausted. Indigenous communities are reporting rising case numbers, with approximately 1/3 of all cases currently active and about 12% of these in hospital. Everywhere, community transmission means growing numbers of cases linked to schools, including some school-based transmission, putting increasing numbers of students out of school, adding to the already heavy burden on hardworking teachers, administrators, and families. Many outbreaks are linked to informal social gatherings with family and friends, where public health practices such as physical distancing and masking are not being consistently observed. These events are amplifying COVID-19 spread in many areas and imposing a heavy strain on public health and healthcare systems for testing, tracing, and follow-up.
Diapositive 8. La propagation de la COVID-19 dans les populations et les milieux à haut risque est très préoccupante, particulièrement à mesure que plus d'éclosions et des éclosions de plus grande taille sont rapportées dans les établissements de soins de longue durée, dans les milieux de soins et dans les communautés autochtones. Les éclosions dans les établissements de soins de longue durée mettent les résidents âgés à risque de maladies pouvant avoir une issue fatale. Les éclosions dans les milieux de soins mettent une pression accrue sur les capacités du système de santé et affectent directement la santé et le bien-être des patients et de nos professionnels de la santé qui sont de plus en plus épuisés. Les communautés autochtones rapportent un nombre de cas allant en augmentant rapidement avec près
with
d'un tiers des
approximately
cas qui sont
one-third
actifs
of all
et
cases
environ
currently
12
active,
qui
and
sont
about 12%
hospitalisés.
of these in hospital.
Partout, la transmission
Everywhere,
communautaire se
community
traduit
transmission
et un
means
nombre
growing numbers
croissant
of
des cas
cases
liés aux
linked to
écoles,
schools,
incluant de la
including some
transmission dans les
school-based
écoles, ce
transmission,
qui conduit à
putting
un nombre
increased
croissant
numbers of
d'élèves en
students out of
isolement,
school,
ce qui
adding
impose
to
une
the
charge
already heavy
supplémentaire
burden
aux
on hardworking
enseignants,
teachers,
aux administrateurs
administrators, and
et aux familles
families.
qui travaillent dur. De nombreuses éclosions sont liées à des
Many
rassemblements en
outbreaks
famille
are linked
ou
to
avec des
informal
amis
social
ou des
gatherings
pratiques
with
de santé
families and
publique
friends,
telles que
where
la
public health
distanciation
practices
physique
such as
et le
physical
port de masque
distancing and
ne sont pas
masking
respectés
are
de
not being
manière
consistently
systématique.
observed.
Ces événements
These
amplifient la
events are
propagation de la
amplifying
COVID-19
COVID-19
dans
spread in
plusieurs
many
régions
areas
et
and
imposent une
imposing
forte
a heavy
pression
strain
sur les
on
systèmes
public
de santé
health
publique et de
and
soins de
healthcare
santé,
systems
en
for
ce qui a
testing,
trait au dépistage, à la
tracing,
recherche de contacts et
and
au suivi
follow-up.
des personnes infectées.
Slide 9. Hospitalizations have been increasing for many weeks, following consistently elevated disease activity over the past 2 months. Over the past week, an average of almost 1,800 people with COVID-19 are being treated in Canadian hospitals on any given day, including over 375 people in intensive care units. The strain on health systems has resulted in hospitals having to postpone important medical procedures, while critical care beds for COVID-19 patients have reached or are at near maximum capacity in some areas. Even when hospitalization is not required, prolonged illness and complications can occur and affect people at any age.
Diapositive 9. Comme prévu, nous avons observé une augmentation de l'ensemble des hospitalisations, et ce, depuis de nombreuses semaines suite à l'augmentation continue de l'activité de la maladie au cours des 2 derniers mois. Au cours de la dernière semaine, près de 1 800 personnes atteintes de COVID-19 ont en moyenne été traitées dans les hôpitaux canadiens chaque jour,
people with
dont
COVID-19 are being
375
treated
dans les
in
unités
Canadian
de soins
hospitals on
intensifs.
any given day,
La pression sur les
including
systèmes
over
de soins a
375
entraîné
people
un
in
report de
intensive care
procédures
units.
médicales important dans les hôpitaux, tandis que les lits en soins intensifs
The
pour les
strain on health
patients
systems has
de
resulted in
COVID-19 ont
hospitals having to
atteint ou
postpone
sont
more
presque à leur
important
capacité
medical
maximale
procedures,
dans
while
certaines
critical care
régions.
beds for
Même quand les
COVID-19 patients
hospitalisations
have reached
ne sont
or
pas
are near
requises,
maximum
une
capacity
maladie
in some
prolongée et des
areas, even
complications
where
peuvent survenir et
hospitalization is
affecter
not
des
required,
individus
prolonged
de tous
illness and
âges.
complications can occur and affect people at
Slide
any
10.
age.
Looking to the experience of other countries, many of which have been ahead of Canada's trajectory, helps us to anticipate what we might expect to see here in the coming weeks. Several Western European nations that experience resurgence are seeing hospitalization rates approach or surpass the height of the first wave, which is causing immense strain on their health systems. In response to surging hospitalizations, these countries close non-essential businesses and ask citizens to limit outings to essentials while keeping schools open. As a result, some countries, including France and Belgium, are beginning to see a decline in disease activity.
Diapositive 10. Si l'on s'intéresse à l'expérience d'autres pays,
Looking
plusieurs
to the
d'entre eux
experience
ont
of
quelques
other
semaines d'avance sur le
many
Canada
of which
dans
have
la
been ahead of
trajectoire de
Canada's
l'épidémie, ce
trajectory,
qui nous permet d'anticiper
helps us to anticipate
ce
what
à
we
quoi
might
nous
expect,
pourrions nous attendre dans les
might
prochaines
expect to see
semaines.
here in the coming
Plusieurs
weeks.
pays de l'Europe de l'Ouest qui ont connu une
Several
forte
Western
résurgence
European
des cas
nations that
ont maintenant
experience
face
resurgence
à des taux
are seeing
d'hospitalisation
hospitalization
qui
rates
approchent ou
approach or
excèdent ceux
surpass the
connus
height of the
lors de
first
la
wave,
première vague, ce qui met
which
à
is
rude
causing
épreuve
immense
sur les
strain
systèmes de
on their
santé
health
régionaux
systems,
et nationaux. En
national
réponse
and
à la
regional.
recrudescence des hospitalisations,
By
ces
mid-October,
pays ont
in
fermé
response
les
to surging
entreprises non essentielles
hospitalizations,
et demandé
these
aux
countries
citoyens
closed
de ne
non-essential
sortir
businesses
que pour
and
des
asked
raisons
citizens to
essentielles,
limit outings to
tout en
essentials
maintenant les
while
écoles
keeping
ouvertes.
schools open.
En conséquence, certains
As a
pays,
result,
comme la
some
Belgique et
countries,
la France,
including Belgium
commencent à
and France,
observer une
are
baisse
beginning
dans
to
les
see a
niveaux
decline in
d'activité de la
disease
maladie.
activity.
Slide 11. As with hospitalizations, deaths are late indicators of COVID-19 severity and can lag behind increases in reported cases by several weeks. Over the past week, an average of about 70 deaths have been reported daily, marking a notable increase over the last several weeks. Our most elderly citizens continue to be at high risk due to both outbreaks in long-term care homes and increased disease transmission in the community. Recently, a few deaths have occurred among individuals in their 30s, serving as a reminder that young adults may also experience severe outcomes of COVID-19. As more people become infected, we will observe increasing numbers of these rare events.
Diapositive 11. Tout comme les hospitalisations, les décès constituent des indicateurs
As
tardifs
with
de la gravité de la
hospitalizations, deaths are
COVID-19
late
qui peuvent
indicators of
survenir avec un
COVID-19
délai de
severity
plusieurs
and
semaines
can lag
après
behind increases in
l'augmentation des cas
reported cases
déclarés.
by several weeks.
Pendant la dernière semaine, environ 70
Over the
décès
past week,
ont
an
en
average of
moyenne
about
été
70
déclarés
deaths have
chaque
been
jour,
reported daily,
marquant une
marking a
augmentation
notable
notable au
increase
cours
over
des
the
dernières
last several
semaines.
weeks.
Nos citoyens les plus
Our
âgés
most elderly
continuent d'être les
citizens
plus à
continue
risque
to
de
be high
décès de la
risk
COVID-19
due to both
en raison
outbreaks in long-term care homes
et des
and
éclosions en
increased
établissement de soins de longue durée
disease
et de
transmission
l'augmentation de la
in the
transmission
community.
communautaire. Récemment, quelques décès chez les personnes de moins de 30
Recently,
ans
a few
constituent
deaths have
un
occurred
rappel
among
que les jeunes
individuals
adultes
in their
peuvent aussi
30s,
subir des
which serves as a
gravitudes
reminder that
liées
young
à la
adults may
COVID-19.
also
À
experience
mesure
severe
que plus de
outcomes
gens
of COVID-19.
sont infectés, nous
As more people
observons
become
des cas plus
infected,
nombreux
we will observe
de ces
increasing
événements
numbers of
rares.
these rare events.
Slide 12. Based on Canadian data up to November the 14th, short-term forecasting shows the predicted cases and deaths due to COVID-19 out to November the 30th. Short-term models continue to be accurate in predicting the growth trajectory. The graph on the left shows the predicted number of cases could be in the range of 366,500 to 378,500 by November the 30th. The graph on the right shows the predicted number of deaths could be in the range of 11,870 to 12,120 by November the 30th.
Diapositive 12. Sur la base des données canadiennes jusqu'au
Based on
14
Canadian data
novembre,
up to
les
November
prévisions à
14th,
court terme
short-term
indiquent
forecasting
les cas et les décès prévus
shows the
dus à la
predicted cases
COVID-19
and deaths
jusqu'au
due to
30 novembre.
COVID-19 up
Les
to
modèles à
November
court terme
30th.
continuent d'être précis
Short-term
dans la
models
prévision
continue to be
de la
accurate in
trajectoire de
predicting the growth
croissance.
trajectory.
Le graphique de gauche
The
montre
graph
que le
on the
nombre de
left
cas
shows the
prévus
predicted
jusqu'au
number of
30
cases
novembre
could be
pourrait être
in the
compris
range
entre
of
366 500 et 378 500.
500 by November
Le graphique de
30th.
droite montre
The
que le
graph on
nombre
the
de
right
décès
shows the
prévus jusqu'au
projected
30
number of
novembre
deaths
pourrait se situer
could be in the
entre 11
range of
870 et
11,870
12
to
120.
12,120 by November 30th.
Slide 13. The longer range forecast shows how the epidemic could evolve in Canada over the next 2 months. What we're aiming for is the safer blue line trajectory. This will require combined effort of individual Canadians and public health authorities in order to sufficiently reduce the current number of people we come into contact with each day. For individual Canadians, this means, whenever possible, reducing the number of people we come into contact with each day while maintaining hand hygiene, physical distancing, and face mask precautions. For public health authorities, this means implementing time-limited restrictions and control measures to further reduce the number of people coming into contact each day across the population. Without sufficient reduction in contact rates, we are forecasting to have 20,000 cases daily by the end of December, with an attendant increase in hospitalizations and deaths.
Diapositive 13. Ces prédictions à plus long terme graphique montrent l'évolution possible de l'épidémie au Canada au cours des 2 prochains mois. Pour parvenir à la trajectoire sécuritaire de la ligne en bleu, il sera nécessaire de combiner les efforts au niveau individuel avec ceux des autorités de santé publique afin de réduire suffisamment le nombre actuel de personnes avec lesquelles nous entrons en contact chaque jour. Pour chaque Canadien, cela signifie de réduire autant que possible le nombre de contacts quotidiens avec d'autres personnes tout en maintenant les mesures de santé publique telles que le lavage des mains, la distanciation sociale et le port du masque. Pour les autorités de santé publique, Cela signifie
For public health
d'implanter des
authorities, this means
restrictions et des
implementing
mesures de contrôle
time-limited
limitées
restrictions and
dans le
control
temps,
measures
dans
to
le
further
but
reduce
de
the number
réduire
of people
davantage le nombre de
coming into contact
entre
each
personnes
day
au sein de la population.
across the population.
Sans une réduction suffisante du nombre de contacts, nous nous
Without
attendons
sufficient
à 20
reduction in
000 cas
contact rates,
diagnostiqués
we are
par jour
forecast to have
d'ici la fin de
20,000 cases
décembre,
daily
suivi
by the end
d'une
of December,
augmentation
with an
des
attendant increase in
hospitalisations et des
hospitalizations
décès.
and deaths.
Slide 14. The only way for Canada to stop the rapid growth of COVID-19 and keep our health, social, and economic systems functioning is for individuals and public health authorities to work together. This won't be forever. Recently, there has been some very good news about vaccine development. Keep this beacon of hope in mind as we all come together apart to do what is needed. Right now, every effort you make as an individual matters. Our best protection for ourselves, our families, and communities is to limit errands and outings to the essentials, keep in-person social activities to your existing household, and strictly and consistently follow public health measures. This includes planning ahead for safer holidays to ensure that we consider the risks, limit our in-person contacts, and get creative so that we can still have meaningful celebrations that are so important for maintaining our traditions and social connections. Thank you.
Diapositive 14. Le seul moyen pour le Canada d'arrêter l'accélération de la croissance rapide du nombre de cas de COVID-19 et de garder intacts nos systèmes de santé et que les individus et les autorités de santé publique travaillent ensemble. Cela ne durera pas toujours. Récemment, nous avons reçu d'excellentes nouvelles sur le développement de vaccins. Gardez cette lueur d'espoir à l'esprit alors que nous conjuguons nos efforts ensemble à distance pour faire ce qui est nécessaire. Actuellement, chaque effort que vous faites en tant qu'individu a de l'importance. Notre meilleure protection pour nous-mêmes, nos familles et nos communautés est de limiter nos commissions et sorties à l'essentiel, de restreindre nos activités en personne aux gens de notre ménage autant que possible et de suivre de manière stricte et constante les bonnes pratiques de santé publique. Cela nécessite de planifier à l'avance pour un congé des fêtes sécuritaires afin de s'assurer que nous avons considéré les risques et limité nos contacts en personne et que nous avons été créatifs pour avoir des célébrations pleines de sens, si importantes pour maintenir nos traditions et nos contacts sociaux. Merci.
Thank you.
Thank you, doctors. We'll now take questions, starting with questions on the phone, 3 questions, and then questions in the room. Minister Heidi will be with us until about 10 o'clock, and then we'll have the doctors for a further 15 minutes. So we'll start with 3 questions on the phone, 1 question, 1 follow-up. Over to you, operator.
Thank you, merci. La première question nous vient de Raymond Filion de TVA.
The first question is from Raymond Filion, TVA. Please go ahead.
Merci beaucoup. Bon matin. Quand on regarde la carte du Canada dans votre
Question.
document,
When we look at the map of Canada in your document, almost all of Quebec is in dark blue. Given this context, are you comfortable with the easing of confinement restrictions that will allow people to meet between the 17th and 27th of December?
Comme j'avais déjà dit plusieurs fois,
Thank you for the
c'est
question.
vraiment
As
les
I've said many
autorités
times,
de la province
it's
qui
really the
sont le plus au
provincial
courant, qui
public health
connaissent
authorities
mieux
who
c'est quoi la
best know
réalité
what's
sur le
happening
terrain dans la
in the
province de
field,
Québec.
in their area,
Je pense
that is,
aussi,
in
j'ai
the province
entendu
of
que
Quebec
ce
in this
que
case.
Premier Legault
I heard what
a dit
Premier
hier,
Legault
c'est vraiment, je
said
pense, comme un contrat
yesterday,
entre
and
toutes les
from what I
personnes, les
understand, this
citoyennes
is
de
a
Québec
sort of
et
social
le
contract
gouvernement.
among
Si
all
tout le monde
citizens,
prend
between the
pour
citizens and the
sérieux
government of Quebec.
ce qu'on fait aujourd'hui, limiter les contacts, faire peut-être même une auto-quarantaine une semaine avant les fêtes, peut-être on peut avoir des rassemblements familiales, je pense aussi plus petites que d'habitude, Mais
which
on peut
will be
avoir
smaller than usual, that is.
des fêtes, des rassemblements pendant les fêtes un peu plus limités.
Means that
Je
we
pense
could
que c'est
have
vraiment très important
smaller,
de
limited social
commencer
gatherings during the
aujourd'hui
holidays.
avec
I think
les
we really
actions
need to
à
start
l'échelle
today
individuelle, mais aussi à l'échelle de
do
gouvernement. Et
things
je suis d'accord
individually
avec
and
ce que le
government-wide.
gouvernement au Québec a
that is-
commencé à faire. Merci.
But I agree with what the government of Quebec is starting to
Vous qui
do.
avez de la famille au Québec, Dr. Njoo, quand
Question.
on regarde la situation actuellement, est-ce
When
que
you
vous
look at
allez
the
être à
current
l'aise de
situation,
célébrer à 10
would
personnes
you
dans une
be
maison?
comfortable celebrating with other people if you had family in
C'est
Quebec?
difficile parce que je pense
Answer.
que aussi c'est très
Well, it's
important
hard to
pour
say.
chaque personne
It's very
peut-être
important for
regarder
every
dans le miroir et
person
faire comme on
to
dit
take a look in the
une
mirror
auto-évaluation
and
des risques parce que c'est vraiment une question
assess
de
their own
tolérance de
risks.
risque aussi gestion de
It's a
risque.
matter of
Je sais
tolerance,
pas,
risk
moi je peux
tolerance
dire
as well, risk
peut-être
management.
élaborer sur ma situation personnelle. C'est peut-être intéressant. Ma belle famille est québécoise.
I
Moi,
should say that
je
my
profite,
in-laws
j'adore
are
les rassemblements
from
pendant les fêtes,
Quebec, and I
normalement
love
des
social
autres années
gatherings
avec
during the
ma belle
holidays.
famille, mais cette année,
as we've done
je
every other
planifie,
year, meeting the
c'est
in-laws.
seulement un rassemblement
However,
avec
this
nos
year,
enfants.
we will
On
only
va pas
be
voir les
the
rassemblements
immediate
avec,
family,
comme
that
on
is,
dit, la grande
with
famille.
the
Aussi, j'ai
with our
aussi parlé avec
children.
mon fils.
We
Mon
won't be
fils
meeting
habite à
our
Montréal. J'ai dit, est-ce que
wider
toi,
family. My
est-ce
son
que
lives
toi,
in
t'es
Montreal.
prête à
I
être
said,
en quarantaine
are you ready to
volontaire
go
pour
into
les 2
quarantine,
semaines
volunteer
avant de
quarantine for
quitter
2
Montréal
weeks
pour nous
before
visiter
leaving
ici à
Montreal
Ottawa?
to
J'ai dit,
leave
oui, papa, c'est
and
très
come home
important.
to Ottawa?
Je vais le faire.
He said,
Bon,
yes,
ça, c'est aussi,
I'll be doing that.
Une autre bon plan.
That's
Et
a
finalement,
good
quand
plan.
on va avoir un petit rassemblement, vraiment avec sûrement la petite famille chez nous, tout le monde
But
va
as I
porter
said,
des
we'll
masques,
only
on
be
va garder
having
la distanciation physique et
the immediate family at
des bonnes
home will
mesures
be nonetheless
d'hygiène,
wearing
lavage de
masks,
mains, tout ça. Ça, c'est comme un exemple
physically
comment je pense que
distancing,
tout le
washing our
monde doit
hands
planifier et
frequently.
ça, c'est mon
That's an
plan
example of
personnel.
how people can plan, and that's my own personal plan.
Thank you, merci. Next question is from Ryan Tumilty from the National Post. À vous la parole. Please go ahead.
Yeah, good morning. I'm wondering, with the projection of 20,000 cases per day, that's the course that, as I understand, we're currently on, would that overwhelm our healthcare system?
Maybe I'll take that question. This is Theresa Tam. Even right now, the healthcare system in certain jurisdictions, certain cities are already feeling the pressure. So if that's happening now, you can imagine that these exhausted healthcare workers, are not going to be able to cope. And right now, what I heard is that some of the local jurisdictions are already scaling back elective procedures, surgeries, as their cases go up. So that's one of the first steps that shows that there's already pressure on the current system. So with the trajectory, that's going to be really difficult for them. But what we're trying to say is don't get there. You can bend it, follow that blue line, and you'll be below the 10,000 cases. Also, just to reflect on some of the previous question too, so what you're seeing as a snapshot is what happened a week or two ago. We do know that some jurisdictions have applied some increased restrictions. So we will try and see what that looks like. For example, provinces like Manitoba that actually, and of course Nunavut having had its cases, so that the colored map doesn't reflect, what might be happening right now. It reflects what actually happened a week or two ago as well.
And then just to follow up, and you sort of touched on this already, but the restrictions that we have seen so far, are they enough to bend the curve down, or do you think public health authorities in some parts of the country have to take bigger steps?
Well, I think, we look at things at the national level, and the projections, what I've projected is we are not on a good trajectory. So I think across the board or across Canada, we have to say that the time is now with urgency that we limit contacts. However that is being done at the local level, that's That is the underlying principle. Keep those contacts down by restrictions, and of course, each individual doing their work. The other message, which may not have come through this presentation, but we've been saying repeatedly, is that as things escalate and you're going to put in measures, do it fast, do it early and do it fast. So that is, for areas that haven't observed the increase yet, that is really important.
Next question.
Thank you. Merci. Lina Dib, La Presse Canadienne, à vous la parole. Please go ahead.
Oui, merci. Dr. Tam, I was wondering,
the Canadian
the
press.
scariest scenario, the orange one in slide 13, have you quantified what is an increase of contact? What percentage of increase are we talking about?
I know that in the past when we're trying, this is a model that comes of the Simon Fraser University, and with the orange line, what it's telling you is don't go there. Everything that we do now has to be avoiding that situation. It's very difficult to quantify, and the confidence intervals and things like that will be wide as you look at that trajectory. So it's difficult to say, but absolutely do not go above what we have now. Otherwise, we are in really in trouble. So we are focusing on I think it's the gray line that's in the middle, the current trajectory, to send that urgent message to people to reduce contacts. It almost doesn't matter how many percentage you increase, it's just not good to go above what the current level. And then, of course, you can. We've seen, look at the European countries. We've just shown you France, Belgium, and others that were having a massive increase. And with some of these restrictions, we know it can improve. And so I think that's the underlying message.
It's Dr. You maybe going to just add to that as well. I think what we've been saying all along is that it really is a matter of mobility, both the number and the degree of contacts. So I think it's not just about public authorities and what they do with, be it bars and restaurants. It's for every single individual citizen. If individual citizens decrease, quote, the degree and number of contacts, and it doesn't matter, you can talk theoretically about a certain percentage, that's what's going to drive it down in terms of hopefully the incidence of cases. As Dr. Tam and I have said, is that, well, if it's certainly the cases continue to increase, then it means that unfortunately with the current, let's say, measures in place and also the activities of individual citizens, that hasn't been enough. And that's why at some point you might need to put more restrictive measures in place. That's what we're seeing in Europe. And you can see that if you get to the most restrictive measures, you will see a difference and the rates will go down. But hopefully here in Canada, we won't get to that point, but we're certainly close to that, if not in some places already at that point.
Okay, so Dr. Tam, when you're saying we don't go above what we have now, you're talking going above more contacts. I'm assuming that's what I understand. So can you have an idea of what impact those 4 days of gatherings in Quebec that were given a green light yesterday would have as an effect?
It's maybe it's Dr. Njoo. Maybe I can speak to that. I think what the government of Quebec, what Premier Legault said yesterday, I think it's important. I think he is actually saying the same things that we've been saying, that it's not just the governments alone. I think he's appealing to the individual citizens of Quebec, saying, hey, it's a bit of a social and moral contract. I'm not sure if I'm using the right wording, that if people really limit their sort of number of contacts, sort of even the week or so before and the week or so after that, then yes, then to a limited degree, then yes, let's try and have as not close to normal, but at least a kind of a holiday sort of season with the 4 days you're talking about around Christmas to have those smaller gatherings. But even then, it's not to the same extent, and I know I've already mentioned before, with my in-laws, it won't be the type of large family gatherings, which I know are so important, especially in Quebec. It'll be more limited. So I think it's a bit of a do your homework now before the holidays. Then you can have some limited get-togethers during those 4 days, and then afterwards as well. Maintain strict measures, and then hopefully everyone will get out of it okay afterwards. Thank you. En français, je pense que ce que le premier Legault a élaboré hier, c'est vraiment comme une, je ne sais pas, une entente, une contrat, peut-être une discussion avec les citoyens de Québec. Si tout le monde est prêt, peut-être de se mettre peut-être en auto-quarantaine la semaine ou 2 semaines avant les fêtes, c'est possible. Avec les 4 jours pendant la saison des fêtes, de peut-être célébrer avec des rassemblements familiales, mais aussi plus petits qu'avant, que d'habitude. Et si on fait ça, aussi peut-être que la semaine après, c'est très important aussi de continuer avec les bonnes pratiques, aussi limiter le nombre de contacts. Et je pense que c'est peut-être l'équilibre on cherche pour maintenir un certain niveau pour ne pas avoir encore une résurgence des cas.
That would prevent a surge.
Thank you. We'll take questions
another
in the room
surge.
now.
Hi, doctors. Mackenzie Gray with CTV News. In the U.S., Dr. Fauci has said he's urging a uniform virus strategy, not a disjointed move by states. In Canada right now, it's quite clear that there is a disjointed approach to COVID-19. Just recently, BC mandated masks, despite the fact that in Ontario, for many months, masks have been mandated inside. At this point in time, with such dire warnings in the modeling today, do both of you think that it's time for a national uniform approach in how we deal with COVID-19?
Well, I think the core public health measures are, we've said it so many times that we probably don't have to repeat them again, and every individual should be following those measures. I think what you're talking about, whether it's mandatory or not, it really is down to the individual provinces and localities. And I've always said the local medical officer probably knows their population best. However, learning from other jurisdictions, sometimes mandatory helps everyone. It takes the guessing work out of people. It just makes life a lot easier for businesses and for individuals. So I think that's where I think BC has come to its conclusions. And they have had different epidemiology. But if you looked at the map now, there's a more homogeneity now in the experience amongst provinces outside of the Atlantic and some of the territories, but even the territories are getting impacted and putting in more stricter measures. And so I think that what you will see is, in fact, that things are actually getting more homogeneous, even from a public health perspective, measures, given the epidemiology is evening out, not in the right direction, by the way, but across the country.
Anything to add to that, Dr. Njoo?
Nothing really more to add. I think maybe just to build on what Dr. Tam said, we've been meeting regularly. I think just this week we had our 100th teleconference with the Special Advisory Committee. So those active discussions with our counterparts in the provinces and territories, we've always been on the same page with the science in terms of how it should be applied. But as Dr. Tam has said, that at the end of the day, it really depends on the situation at a local level, also maybe at a provincial level, in terms of the context, the population, as to how, quote, the principles are best applied.
Ms. Haidu, the Ontario Health Minister, the Ontario Premier, the Quebec Premier, the Minister of Social Services in Saskatchewan, and Dina Hinshaw in Alberta have all said that Canada is going to receive 4 million doses of the Pfizer vaccine and 2 million doses of the Moderna vaccine between January and March. Doug Ford said he got that information from the health department, yet yesterday the Prime Minister refused to give that information. Can you come clean with Canadians now and say if we are going to get those doses of the vaccine by the date that 4 provinces have said we are going to?
Well, thank you. And, listen, the delivery schedule is one thing, and then the successful delivery of the vaccines is another. Obviously, the premiers are working on documents that we're sharing with provinces and territories as we work through the distribution plans. I think the assertion of the various provinces around the number of doses that they are going to receive in their own jurisdictions is the area where we have not come to an agreement on yet. Provinces and territories, along with the federal government, have negotiated sharing agreements for all of the things that we've needed for the pandemic, whether it's personal protective equipment or testing, and we'll do that with vaccines as well.
the number of vaccines that Canada is going to get, not what the provinces are getting. We understand that that's up in the air, but this is an agreed upon number that 4 provinces have said. I do not understand why you cannot confirm that number.
We'll get the numbers to you. I don't have the exact number of doses here, but all I'm saying is, look, I think the point of disagreement is the number of doses that the provinces and territories are projecting to get themselves. And again, I'll repeat, we will be working out and are working out with the provinces and territories a sharing agreement on the number of doses each province and territory can expect to receive when those vaccines arrive in Canada. There are a number of steps to continue to go through to receive those doses on Canadian soil, including the regulatory reviews, which are underway, by the way, right now for Pfizer and Moderna. And as we work through the agreement with provinces and territories on how we will share those doses, we'll come back to Canadians and be very clear and transparent. En français, si possible. Je peux essayer. Nous avons un processus avec les provinces et territoires pour distribuer l'équipement médical comme les pistages, comme les PPE et les mêmes choses pour les vaccins. Nous avons un système
and the same holds true for vaccines. We have a system. We speak together, make decisions regarding access to these vaccines.
Thank you. Next question.
Oui, donc c'est toujours pour vous, Madame la ministre, Juliane Lapointe de Radio-Canada. Sur les vaccins, vous en avez un peu parlé dans votre réponse en anglais, mais est-ce que vous avez des indications que Pfizer demandera aujourd'hui ou bientôt d'homologuer son vaccin candidat comme elle le fait aux États-Unis? Et je vais aussi répéter en français combien de doses on peut s'attendre à avoir. Est-ce qu'on a des chiffres déjà pour le pays et à quel moment?
Do you have numbers for the country and when they will be coming?
Les bonnes nouvelles
The good news is that Pfizer has applied to Health Canada for the approval of its vaccine. We do have a process called the rolling review process for vaccines.
Les manufactureurs peuvent provider les data quand nous avons le data et we review the data as we see it. In terms of doses, we'll have more details on doses as we move forward.
Et oui, donc une question pour le docteur Njoo ou docteur Tam, si vous voulez ajouter aussi, vous avez mentionné dans vos tableaux notamment que quand on regarde les courbes dans les autres pays de l'Europe notamment, ce qui fait qu'on a vu une diminution du nombre d'hospitalisations, c'est quand on a limité, fermé les commerces, limité aux sorties essentielles finalement, comme les écoles. Est-ce que vous croyez que c'est ce qu'il va falloir faire ici et à quel moment vous pourriez, à quel point il va falloir atteindre pour que vous en veniez à suggérer de faire ça
before
ici au
you
Canada,
suggest that that's what
une
needs to
suggestion
be
que vous
done
pourriez
here
faire au
in
gouvernement fédéral?
Canada?
C'est Dr. Njoo, peut-être moi je peux commencer. Comme on
I can begin.
mentionné plusieurs fois, c'est
As we've mentioned several
vraiment les
times,
provinces et territoires
it's really the provinces and
connaissent leur
territories
situation,
that
leur
know
réalité, qu'est-ce qui se
their own
passe sur le
situation, the
terrain.
reality of what's
C'est
happening
eux
on
qui
the
vont
ground.
prendre les
And they will
décisions
be making the decisions,
appropriées, je pense,
the
selon leur
appropriate
contexte.
decisions for their
C'est pour
context.
moi aussi comme peut-être une observation personnelle.
If I
Qu'est-ce
may
qui se
make
passe
a
en Europe?
personal
Si on regarde peut-être la
observation.
France, c'est un
What's
pays
happening in Europe?
avec
In
la
France, for
densité de la
example.
population.
France is a country
C'est
with a
beaucoup plus
high
différent qu'ici au Canada.
population
Le Canada
density.
est
It's
un
much
grand
different
pays.
than Canada.
Qu'est-ce qui se passe au nord dans les
Canada is a
territoires,
very
aussi même
large
dans la
country.
bulle atlantique,
If you look at what's
Colombie-Britannique,
happening
Québec,
in the
Ontario,
territories and the
c'est
Atlantic
vraiment
bubble
toute
in
une variation
BC and in
comparée
Quebec, well,
si on parle des
it's
plusieurs
completely
pays en
different
Europe.
from one
Je pense
place to the
que c'est
other.
important de toujours apprendre
I
qu'est-ce
think
qui
it's
se passe avec
important
les
to always
expériences dans
learn
les
what's
autres pays
happening
pour
from
aussi
in other countries, to learn from their
voir c'est quoi
experiences, and also see
les bons résultats des mesures mises en place. Et c'est
results,
sûr que
what measures have
ici au
given
Canada,
good results.
les provinces et
Here in
territoires
Canada,
ont commencé
the
à mettre
provinces
les
and
mesures
territories
selon
have begun
l'épidémiologie et
to
la
implement measures
réalité sur le
based
terrain.
on the reality on the ground.
Thank you. Next question.
Hi, Marika Walsh with the Globe and Mail. I'm just trying to understand where you see Canada going. I understand that you want us to go on the blue line. I would say that the numbers that the modeling you released 3 weeks ago and the ones you're releasing now shows we're somewhere between the gray and the orange line. So where is Canada going in your estimation, and how does that compare to, for example, Europe, the countries that you put in the slide as well?
So I think a little while, well, maybe it was a week ago, we were saying that by the beginning of December, if we go on the current trajectory, we'll see 10,000 cases a day. That aligns with some of the sort of doubling time, if you like, in each of the jurisdictions as well. So we're now, 2 weeks ahead. But we have seen some jurisdictions having put on some brakes, right? So they've been, you've seen the curves of the 6 provinces, and we've seen some increase in measures. And I mentioned Manitoba just because they did just put in some amazing, more restricted measures. Now, of course, that takes a little bit of time for us to see whether it has an impact. And I expect that it will, because if you looked at the European countries, we know how this virus is spread through interactions. Once you start limiting them, I expect that we will see some of those curves beginning to bend. But we can't release the brakes rapidly unless we're absolutely certain that other measures have been put in place to control or limit that spread. So I think that's the really important thing. So I think that we are still on, I actually think we're probably on that gray trajectory because we're at about 5,000 or just under 5,000 cases a day right now. But things could change. And so, but other jurisdictions have also increased the measures. So you've just heard British Columbia and others. But this is really important because the country is heterogeneous in its epidemiology and the timing of those breaks. And so the composite picture is at the national level is depending on that. So I do think we're on that gray line right now, and we have every chance to bend the curve. We must not increase our contacts, but in our messaging, by restricting your sort of non-essential travel, restricting your non-essential contacts that keep to your household. Household doesn't mean your, university student son who's living somewhere else. Household means the people that you've been living with in the last 14 days. Keep to those. And just right now, because that is going to reduce the contact rate substantially. Some jurisdictions are currently still keeping schools open because they haven't observed sort of really important transmission in the school setting. The schools are reflecting the community transmission. But because your kid is going to school, you've really got to then reduce the other contacts that you have. So I think that's the message. And going into the projection going to the end of the year. So you're going through the Christmas period and to New Year's Eve, let's just say. Really, in order to get to the blue line, we've got to sustain the restrictions. But if we bend the curve fast in the next weeks, well, let's just see what happens before the Christmas vacation. But as Dr. Njoo also said, it's going to be a very different Christmas. I was going to say, in fact, having the talk, it takes on a different meaning right now. You have to have the talk with your son who's coming home, right? And how in Dr. Njoo's case, have the talk because I was just thinking, you have to plan ahead and be really firm because sometimes you can't refuse your family members and it's really difficult. But have that firm talk, and it's a difficult one. Make your expectations known. Like if you're a high-risk person, you could actually refuse some family members. If some family members are coming in as a guest over the Christmas vacation, you have to take certain measures, some of which might include limiting contacts for 14 days before you go visit your older relative. So if people are going to go back and visit their family, then take these measures. Tell your guests in your small gathering, if that is where you're going, that you expect them to wear a mask. They're going to be sitting at the other end of the dining room table with, maybe sometimes outside if part of it, your weather allows, but wear a mask, washing hands, use a different washroom to everybody else might be your expectation. So have the talk with people. And so, so I think, our message at this point, if you looked at that projection, is really limited to your household for celebrations. For people who we know it's important to get other maybe contacts with their family because they're lonely and their elderly relatives, take those measures to really reduce the risk if you're going to do that.
Just before the follow-up, Minister Haidu does need to leave now. The doctors will still be here. I'm sorry.
If he can go first and get Haidu, I'll come back for my follow-up because with Dr. Tam.
Okay, go ahead, David.
Sorry, Minister. David Aiken, Global News. Prepare for the worst, hope for the best, disaster planning 101. I've heard Dr. Tam talk about every chance to stay in that blue line. Are you preparing for 20,000 cases a day? Do we have enough PPE, ventilators? What about isolation accommodation for people in Nunavut, those sorts of things? Can you speak to your government's plan to prepare for the worst?
Absolutely. Thanks for the question. I am exactly that kind of person in my own life. I've sometimes mocked by my family for my worst case scenario planning, but we have been doing that. Obviously, it's, the federal government is not in the business of delivering direct health care, but we've been building up our capacity to support provinces and territories with surge demands for a very long time over the summer months, etc. In fact, we have a number of supports deployed right now to Ontario, Quebec, Alberta, Manitoba, including Red Cross personnel, extra testing capacity, in some cases isolation centers that the provinces, territories, and local public health are running, obviously contact tracing, and of course we'll be there for whatever they need to deliver in their healthcare responsibilities. The provinces and territories, the health ministers, we also meet. I don't have the exact number of times that we've met, but we meet weekly to talk about what kinds of needs that they're anticipating in managing their own surge and how I best can be positioned to support them as the federal health minister. And so we continue to build up that capacity. But I'll just say this, it's not limitless, as we know, and the biggest limiter is actually healthcare resources, people, healthcare professionals, because as we know, those are hard to find. It is getting increasingly difficult for healthcare workers across the country, including frontline healthcare workers, pharmacy workers, personal support workers, as people have been working flat out for 10 months and are exhausted. And that is a limiting factor for all of us.
Follow up?
Mine's for Dr. Tam. So, Minister,
thank you very much.
Marika, you can continue. Thank you.
Tam, the other thing that struck me from your modeling is this, what you're calling the larger and more outbreaks in long-term care. Can you speak to whether local healthcare systems have learned the lessons of the first wave and whether we are on track for repeating what happened in the first wave in long-term care?
I think that is such an important part of the response. You've got to do everything to reduce the risk of introduction, rapidly detect if you had an introduction, test widely in those settings so that you can prevent the impact. So as we started through the beginning of this resurgence, we were not seeing that many long-term care facility outbreaks, and they had smaller numbers of cases. What we're seeing now is that with increased community transmission, the numbers of long-term care outbreaks have increased, and the numbers of people affected in those facilities or those homes have increased as well, which is really worrisome trend. But again, we know what to do, and people just need to double down to support those. As Minister Haidu has said, some of the sort of challenges, I think, is health human resource. So having the trained staff to support those jurisdictions, which is a difficult thing for the local jurisdiction. At the federal level, we have engaged the Canadian Red Cross and others to try and support those efforts, whether they support long-term care, supporting testing, and supporting isolation measures, providing voluntary isolation sites. So, I mean, the key is, as you say, right now, we kept sort of saying that the deaths are the lagging indicators. We are not necessarily seeing the impact of the current acceleration in the community on our most vulnerable. So absolutely, we need to do better. I do think things have improved in many areas, but there are some long-term care facilities in particular that are having some repeat outbreaks. So those are the ones that at the local level, they, I think, need to focus on and again, do whatever they can to improve the situation.
So you don't think we're repeating the first place? Are we on track to repeat it or are we not for Houston Network?
I don't know right now, and you can, as I said, you can sort of stop it and put the brakes on. I do think that many long-term care facilities are doing better. But there's a limit to how people can cope, so that we all have to do our best to reduce community transmission to the extent possible. I also think that we have many other tools now. So as we've sent out quite a large number of rapid tests in the jurisdictions and point of care diagnostics, the application of some of those in the high-risk settings would be very important, I think, in reducing it. No, we're not on that trajectory the same as the last time, but we can't go there.
Thank you, Dr. Tam. Just a quick reminder that it is one question, one follow-up. David will take your follow-up now.
Yeah, and I just have one follow-up, Dr. Tam. So the last slide was about all the things we can do, but in your comments on the slide where you talked about testing rates, you mentioned that we're not doing enough testing. Could you elaborate on what the problem is at this point, so many months in, on why aren't we doing enough testing? Is it because we aren't showing up at testing facilities and there's unused testing capacity? Or as I suspect, there's not enough testing capacity. Can you tell us what we're doing about fixing the testing problem?
Well, I think, at the federal level, our role is to provide support to the provinces to, we've actually been acquiring, the regulators been doing what they need to. We've acquired a lot of tests. We've now deployed them. There are guidance for their use. So part of it might be just at the local level, figuring out the operationalization of those new tests that we've implemented. The other thing is that we do know provinces have augmented their capacity, even for the PCR tests, quite a bit higher than the rate that they're testing on a daily basis. I actually think the reasons can only be described by the local authorities, but some of the observation is that we need to, again, support people to get tested. So access. I would say access in the most areas at the highest rate. So some of it might be more creatively. I know that in some jurisdictions, they're beginning to look at, well, what about those mobile sites? What about opening more sites? So access might be one. Two is we need to ensure that people are still encouraged to get tested. Not everywhere, but some jurisdictions have said that people want to keep going with work sometimes, even when they have symptoms. They're worried about their work and job security. They're worried about, keeping things going. We want to make sure Canadians hear the message, I think, from across the country, that if you have any symptoms, go get tested. We must not stigmatize populations that are experiencing outbreaks. We must encourage them and provide them with the testing necessary. So there may be a variety of different reasons, but I think we will do what we can to help. One encouraging thing is that with some of the point of care testing, they have been deployed to the rural and more remote areas. Nunavut is able to do their own on-site testing, whether it's Rankin, whether it's Iqaluit. So and they've been rapidly trying to test the communities using their own capacity right now. So we're behind them if they need it, but it seems that they've augmented the capacity. They are able to test those communities. So it will be different and varied, I think, across the country as to why we're not seeing wider testing. But, we will be trying to encourage more of that.
Thank you, Dr. Tam. We'll turn to the phone now for one question before coming back to the room. Operator?
Oui, merci. La prochaine question est de Hélène Buzetti, Le Devoir. À vous la parole.
Next question from The Devoir.
Yes,
Please go
Tam,
ahead.
I know the question has been asked, but the answer was not super clear. So I'd like to get back to the situation in Quebec. I'm just wondering, is the permission given to gatherings of 10 person, is it more susceptible to get us closer to the orange line versus the gray line on your graph?
So I think the concept is to reduce the number of interactions. So whatever you can do to reduce that. It's difficult to quantify because it's a combination of the gathering size, but other interactions as well. So yes, I mean, by limiting further the gathering size is going to help. That national level and super high level sort of projection cannot take care of every single sort of scenario in different settings. But yeah, by limiting any gathering size to smaller numbers is going to help for sure.
Yeah, as Dr. Njoo would add, I think some people maybe are fixated on sort of, the 10 or whatever number for the actual sort of get-togethers during, the 3-4 days sort of around the Christmas holiday. But I think the important thing that the Quebec authorities are also putting forward is sort of what people should consider and think about doing sort of before and after. And I've heard about sort of this limiting or sort of a self-quarantine for the week or so before those 4 days, and then as well afterwards. So I think all of that put together, I think the message loud and clear is really limit as much as possible your contacts, keep it to your household. But, we know that the holidays are important for many reasons, socially, culturally, and especially also in Quebec. And so by putting certain sort of parameters in place, I think what the Quebec government's trying to do, but I think it's across the country as well, is have people think about how can you have a safe holiday to the extent that it's possible now in the time of COVID-19. That won't be obviously the same as we've had in previous years.
I understand all that, Dr. Tam, but you said that we should be trying to limit the size of gatherings. So my question is very simple. If we do have those gatherings of 10 people, should we expect the number of cases to increase in Quebec?
So I think limiting any gatherings at the moment in the areas with high rates is really important. So 10 is just a benchmark, but I would suggest that you need to, reduce that as much as possible. So I think, by that reduction, you will see a reduction in community transmission. It's not just the number, it's who's in it and what are the people doing in that group of 10. Because if you're all wearing masks, distancing 2 meters, practicing all the hygienic measures, that's very different to 10 people mingling without a mask and doing whatever they want. So it's not just the limit size, but it does help to have a benchmark so that people can have in their heads that it cannot be big.
Yeah, it's Dr. Njoo. I think maybe just add to that, as we've always said, that there's no single measure that's going to prevent, obviously, transmission. So it's all about a layered approach. And so if people practice all of the good public health measures, be it a gathering of 5, 6, 7, and whatever, 10 people during those days of the holiday season, that's fine. But as I just mentioned, what I think the Quebec government's also doing is that the other layer is that if the people, let's say, who are planning to get together, be it 6, 7, 8, 9, 10, or whatever, are also taking additional measures before they get together, sort of like the week or so before in terms of a self-quarantine. That'll be an additional sort of precaution or measure that would also help limit the potential for transmission. Thank you.
Thank you, Dr. Njoo. We're getting a little tight on time, so I'll turn to the room for one more question. David?
Hi, David Thurton, CBC News. Thank you so much for answering all of our questions. If we increase our contacts, as the modeling says we shouldn't, because we will see an explosion of cases, are we on track to see an outbreaks the kind that we've seen in the U.S.?
Right now, our rates are lower than in the United States. Of course, if you increase your contacts, you could see similar rates to some areas of the United States, for sure. So that you need to sort of avoid that. By limiting sizes of gatherings, going back also to just build on the last question, and in some cases restricting businesses where there's 3 C's, you know, close contact, crowded, and where you have lots of face-to-face shouting, singing, panting. One is trying to reduce the chance of those super spreading events in large clusters. So I'm not sure whether you meant that as outbreaks, but you know, so these kind of measures that jurisdictions are putting in now should be they're all trying to limit the size of those outbreaks and also limit the impact on the public health system who are having trouble contact tracing. So one of the parameters that we've been tracking is how many cases are unlinked to others. And that's been tracking at least a third, in some areas higher. What that's telling me is we could track the long-term care outbreaks. That's easy. Every one of them are reporting. Even one case is an outbreak. Schools are easier because it's a specific set of people. The other outbreaks are much more difficult to track, not necessarily because people don't want to report it into us, but because you're having quite extensive community transmission. You can't link the cases back to specific settings anymore. It's not like when we're trying to put out the sparks at the beginning of the fall. So now you have community transmission, and that is what you're trying to do in a holistic way to reduce the contacts. So we in some areas, they are unable to trace back to specific settings. And that's actually why I think the brakes are being put on now. You need to get back to a point where you can now have tests, you know, much more, able to trace your contacts and isolate them. You need to get back to that point.
Okay, totally different question. Your meeting last night with the leaders of the federal parties, what was that like? Would you like to see more of those kind of meetings, and would you like to see more cross-party collaboration and discussion and something akin to a national task force, as some leaders and some people within the medical community have called for?
Well, I think it's very important to work together. And, you know, I think I'm happy to provide, you know, supports that is needed to make sure everybody understands the situation. But the briefing was very much like what we're doing now, really, in terms of presentations and questions. So I think, you know, and then people take out of it different messages. You know, people can look at the same set of information and interpret them in different ways. So by having these conversations, you know, it's just to increase understanding of the situation. But, you know, now is the time for, again, a whole of society response, and that anything that we have to do to increase, I think, what I call social cohesion is really important. That's what happened in the first wave. That's what happens in countries that are able to manage the outbreak, is actual cohesion in our country and our society. So I think that is a really important thing to do.
Thank you, Dr. Tam, and thank you, Dr. Njoo. That concludes today's press conference.